Skeletal system. Bone tissue makes up about 18% of total human body weight. The skeletal system supports and protects the body while giving it shape and form. Osteology. It is a branch of science that deals with the study of skeletal system, their structure and functions. So the skeletal system, our body weight, it is if think our body weight is 100%. So in that 18% only the bone weight. So bone has 18, it will make 18% of our total body weight. So it will help for the support and protect our body while giving the shape and form. So osteology, it is a branch of the science that deals with the study of skeletal system, their structure and function. So it is about the skeletal system. So the skeletal system composed of bones, cartilages, joints, ligaments. So the skeletal system is composed of these four components like bones, cartilages, joints and ligaments. So further video we will see one by one. So watch till the end. So the functions of skeletal system. First one is support, protection, movement, storage, blood cell formation. Support. It gives a hard framework that support and anchor the soft organ of the body. So soft organ of the body are supported by this skeletal system only. Gives a protection. Next is movement. Allows for the muscles attachment, therefore the bones are used as levers. So help for the movements of the movement like walking, jumping, climbing, help for the movement. Storage. Minerals and lipids are stored within the bone materials. Within the bone material there is a minerals and lipids are stored. Blood cell formation. The bone marrow is responsible for blood cell formation like RBCs, WBCs, platelets. So bone marrow help for the formation of these cells. So the division of skeletal system. The human skeletal consists of 206 named bones. So bones of skeletals are grouped into two principal divisions. One is axial skeletal, the another one is appendicular skeleton. So our human skeletal consists of 206 named bones. So all these 206 bones have a names. So bones of skeletal are grouped into two. Their first one is axial skeletal, another one is appendicular skeletal. Axial skeleton are skull bones, auditory ossicles like ear bones, head bones, ribs, sternum, breastbone, and bones of vertebral column are called as axial skeleton. So appendicular skeleton are consist of bones of the upper and the lower limb like extremites plus the bones forming the girdles that connect the limbs to the axial skeleton. The bones that connect the axial skeleton is called as appendicular skeleton. The bones of upper and lower limbs like extremities are called as appendicular skeleton. So these are the two divisions of skeletal systems. Next is classification of bone based on shape. So bones are classified based upon their shapes. Like there are 5 types based upon shapes: long, short, flat, irregular, sesamoid. Long, short, flat, irregular and sesamoid. You can see the long, it is long bone, and short bone is with very short, and flat bone it is flat only, and it is irregular means it has do not have a shape, and sesamoid bone. So these are the classification of bone based upon the shape. Next is long bone is a greater length. Long bone has greater length than width. It has greater length and are slightly curved. They have slightly curved for the strength. Next is femora, tibia, fibula, humerus, ulna, radius and phalanges. So all these are the long bones. So in the exam they may ask which are the long bones, which are the short bones. So you have to know about this. Short bones are cube shaped. They will have a cube shaped are nearly equal in the length and width. So length and width are same like in a square shape. So short bones are carpal and tarsals. Flat bones are thin and composed of two nearly parallel plates. So flat bones have nearly two parallel plates of compact bone tissue enclosing enclosing a layer of spongy bone tissue. So they have a two nearly parallel plates of compact bone. So they are cranial, sternum, ribs and scapulae. Next is irregular bone, complex shapes and cannot be grouped into any of the previous categories. So in any of the like long, short, flat, they cannot be categorized into these three types. So they are irregular, they cannot be grouped together. So they are vertebrate, hip bones, some facial bones and calcaneus. So all these are four bones, they are irregular bones. Next is sesamoid bones, protects tendons for excessive wear and tear. So they are protect from the tendon from excessive wear and tear. So they are like patella, foot and hands. They are help for the excessive wear and the tear in the bones. So they are the sesamoid bone. So these are the about the bones based upon their shapes. So the axial skeleton. So we have seen the two skeletal system. In this first one is axial skeleton. So axial skeleton consists of skull, vertebral column also called as spinal column, thoracic cage and sternum. So these are all axial skeleton. So first we will see the skull. The skull is situated on the upper end of vertebral column and its bony structure is divided into two parts. So the skull is situated on the upper end of the vertebral column. When we upper end of the vertebral column, the skull is situated. After the vertebral column starts, it has two parts. So the one is cranium, the another one is the face. The one is the cranium, the back side, another one the face is the front side. So this is about the skull. So next is the cranium. It is formed by the flat and irregular bone that provide a bony protection for the brain. It gives a bony protection. Second one is one frontal bone is present, two parietal bone is present and two temporal bones are present. One frontal bone, it is forms the forehead. It forms a part of eye sockets. The coronal structure joins the frontal and the parietal bones, and the two parietal bones, they form a side and the roof of the cranial cavity. It articulate with each other at the sagittal suture. It joins the frontal bone with the coronal suture and the occipital bone with the lomboidal. It's a lomboidal suture and the temporal bone at the squamous suture. And the two temporal bones, these bones lie on each side of the head and form a immovable joints. They are immovable joints with a parietal, occipital and sphenoid and zygmatic bones. The temporal bones articulate with the mandible at the temporomandibular joints. So these about the axial, how they joints and where they are present in the head. So these are the one frontal bone, two parietal bones, two temporal bones are present. Next is one occipital bone, one sphenoid bone, one ethmoid bone is present. One occipital bone, it form a back of the head and most of the base of the skull. Base of the skull and the back of head is occipital bone form. It is immovable. It cannot move with the parietal, temporal and sphenoid bones. And one sphenoid bone, it occupies the middle portion of the base of the skull and it. So it is middle portion of the skull and the base of the skull. It articulate with the occipital, temporal, parietal and frontal bones. Next is one ethmoid bone is present. It occupies the anterior part of the base of the skull. Base of the skull, at the anterior part the ethmoid bone is present and helpful to form the orbital cavity, the nasal spectrum and the lateral walls of the nasal cavity. It is very delicate bone. It is very delicate bone and contain many air sinus that opens into nasal cavity. It contains many of the bone air sinuses that open into the nasal cavity. This is about the bones. So this is a picture where all the bones are located and the names of that bones are present. So take the diagram. Next, B is the face. It is also called as facial bones. They are nasal bones, maxilla, zygomatic bones, lacrimal bones, palatine bones, inferior nasal, concave. So first one is nasal bone, form the bridge of the nose. In the bridge you can see the bridge of the bone, they are called as nasal bone. It is formed by nasal bone. Maxilla form the upper jaw bones and form most of the hard palate. You can see the hard palate and the upper jaw, it is formed by the maxilla, separate the nasal cavity from the oral cavity. So this is the maxilla where separate the nasal cavity and the oral cavity. Zygomatic bones are the commonly called as cheekbones. Zygomatic bones are also called as cheekbones, form the prominence of the cheeks. They form a cheeks. Zygomatic bones. It is also called as zygomatic bones. Lacrimal bones form the part of the middle wall of each orbit. So all the orbit lacrimal bones are form the part of that. Next is palatine bone, form the posterior portion of the hard palate. Posterior portion, backside portion of the hard palate, palatine bones are formed. Next is inferior nasal concave, form the part of inferior lateral wall of the nasal cavity. So of the nasal cavity, it forms the inferior lateral wall of the nasal cavity. So this is about the facial bone. You can take the notes and prepare fastly. So the vomer forms the inferior portion of the nasal spectrum. So the inferior portion of the nasal spectrum form the vomer. Mandible is the lower jaw bone. In the mouth you have the lower jaws. There the bone is formed. It is the largest, strongest facial bone. Mandible is the largest and the longest, strongest bone in the facial. The only movable skull bone. Which is the only movable skull bone. This may the question asked in the exam. So it is a mandible. Nasal spectrum. Divide the inferior of it is the interior of the nasal cavity into right and the left side. So it divides the nasal cavity into right and the left side. It is called as nasal spectrum. You can see when you put hands in your or your finger in your nose, you can see the nasal spectrum. Broken nose is the most case refers to spectral damage rather than the nasal bone themselves. So it is broken bone occur in the here only. So it is spectral damage occurs. Next is orbit. Eye sockets. You can see the orbits when you touch the eyes. You can see the hard part. It is a eye sockets. Next is foramina. Opening for a blood vessel, nerves and the ligaments of the skulls. For the skull, then we need the nerve supply, blood supply. So it is a foramina gives all this blood vessels, nerve vessels on ligament supplied by the foramina. So this is about all. So this is the diagram of the axial skeleton. It is not bit that slow clearly. I will add the other photo also. So this is the mandible diagram. You can see all the reference here only. So next is the vertebral column. Also it is called as spine, backbone or spinal column. So vertebral column has different name like spine, backbone or spinal column. Function, it protect the spinal cord. Vertebral column protect the spinal cord, support the head, serve the point of attachment for the rib, pelvic girdle and the muscles. So it is the attachment, which is a point of attachment of rib, pelvic girdle and the muscles. The vertebral column is curved to varying degrees in different locations. The vertebral column is curved, it vary degree in different locations. Curve increase the column strength, help maintain balance in upright position and absorb shock during walking and help protect the vertebrae from the fractures. So it is all it maintain the balance upright position, increase the column strength and absorb the shock while the walking. This is about the vertebral column functions. So this is the diagram of the vertebral column. So the next is the vertebrae, composed of series of bone called as vertebrae. In adult we have a 26 bone in vertebrae. It is composed of series of bones. 7 cervical bones are present, 12 thoracic bones are present, 5 lumbar, 1 sacrum and 1 coccyx. 7 cervical are in the neck region. 7 cervical are in the neck region, present in the neck. 12 thoracic, they are present in the thoracic cavity in the posterior side. 5 lumbar will support the lower back. We have a lower back, there the 5 lumbar will support. 1 sacrum consists of 5 fused sacral vertebrae. 1 sacrum is fused with the 5 sacral vertebrae. 1 coccyx consists of 4 fused coccygeal vertebrae. So 1 coccyx is fused into 4 coccygeal vertebrae. So this is about the how composed of series of bone called as vertebrae, about the vertebral column. Next is intravertebral disc, found between the bodies of adjacent vertebrae. In the adjacent vertebrae, between the adjacent vertebrae, the intervertebral disc are found. They form the strong joints. They form a strong joint, permit various movements of vertebral column. Vertebral column movement helped by the intervertebral disc help for that. Absorb the vertical shocks. We have a vertical shocks that will absorb vertebrae typically consist of a body, weight bearing, a vertebral arc, sounds that spinal cord. Several processes consist of points of attachment for muscles. So a body which weight bearing part, a vertebral arc surrounds the spinal cord, several process points of attachment for muscles. So this is what the vertebrae typically consist of different parts. Okay. This is the diagram of intervertebral disc. How is the disc? You can see in the diagram. So this is of the diagram I have shown in the intervertebral disc. Next is the thoracic cage. Thoracic cage is formed by sternum, ribs, costal cartilages, thoracic vertebrae. So thoracic cage is formed by sternum, ribs, costal cartilage, costal ribs, thoracic vertebrae. Functions 2. They function as enclose and protect the organ in the thoracic and abdominal cavity. What all the organ present in thoracic cavity and abdominal cavity are, they enclose and the protect. These are the thoracic cage, and provide support for the bone of the upper limbs. Upper limbs bones, they will give a provided support for the upper bones, play a role in breathing, help these thoracic cage help for the breathing. It will expand and recoil during the breathing process. This is what the thoracic cage about. So the next is sternum. It is also called as breastbone, located in the center of the thoracic wall. In the center of the thoracic wall, the sternum is present. It is also called as breastbone. Consists of manburim, body, zyphnoid processes. Consist of manburim, body, and zyphnoid process. Ribs. 12 pairs of ribs are present. We know that 12 pairs of ribs are present. The structure give the structure support to the sides of the thoracic cavity. They give a structure support for the side of the cavity. Next is costal cartilage, elasticity of thoracic cage. Elasticity of thoracic cage. This is what the diagram of the axial skeletal system of the thoracic cage. Please subscribe and thank you for watching my video and stay healthy.